This is the skeletal system presentation for GCSE PE revision. First of all, the functions of the skeleton, or remembered by the acronym SPAN. Support. The skeleton supports the body in different positions, including sitting, standing and laying down, even in a handstand. It provides a framework and gives shape. Protection. Parts of the skeleton, like the skull and the ribs, protect the brain and organs from damage during impact, such as a boxing punch or a strong rugby tackle. Movement. Bones and joints work together to create movement in the skeleton. Tendons and muscles will also help with that function. Joints, a place where two or more bones meet. Limb movements possible at joints include abduction, which is movement away from the midline of the body. Adduction, movement towards the midline of the body, such as bringing your arm in towards your waist. Extension, straightening limbs at the joint. Flexion, bending the limbs at a joint. And rotation, a circular movement around a fixed point. One of the types of joints you need to know and understand is a ball and socket joint found at the shoulder. This joint allows flexion, extension, adduction, abduction, and rotation. The hinge joint, found at the elbow and knee. This joint allows flexion and extension only, such as in a bicep curl. The effects of regular exercise and training on the skeletal system. Ligaments, which attach bone to bone, and tendons become thicker and stronger. This increases joint flexibility and allows more powerful movements to be made. Exercise can increase bone density, making them stronger. But it needs to be weight-bearing exercise, as this can help prevent or delay the onset of osteoporosis. There are no short-term effects of exercise on the skeletal system due to bones taking time. Injuries to the skeletal system that you need to be aware of include fractures. Fractures or broken bones are usually due to a blow or a wrenching. They come in many forms, such as compound, which is where the bone will come through the skin. Green stick, the bone only is partially broken. Simple fractures, bones stay in line. Stress fractures are normally due to overuse in things such as weight-bearing areas, such as the shins. You can get torn cartilage, which is found on the end of a joint. Cartilage is the hard elastic substance found at the end of bones where they meet. A sharp pivoting action can sometimes tear it, resulting in a lot of pain on the inside of the knee. Sprains. This is damage to a ligament. One of the most common is a twisted ankle, which occurs when the ankle turns inward. Dislocations. This is when a bone at a joint is forced out of its normal position. It usually occurs due to a hard blow or impact. Tennis or golfer's elbow. Both of these are overuse injuries to the tendons at the elbow joint. Treatment for injuries. Rice treatment is used for strains, sprains and bruises, soft tissue type injuries. This includes rest, ice, compression and elevation. Rest means stopping the activity to prevent further injury. Ice, apply an ice pack to reduce blood flow, pain and swelling. Compression, then wrap a bandage tightly around the area to reduce internal bleeding and swelling. Elevation, raise the injury above the heart level to reduce swelling and throbbing. This treatment can lessen the pain and help to reduce the injury's recovery time. Diet and the skeletal system. Calcium. This helps the bones grow and increase in density. Vitamin D is essential to help bones grow, as it helps calcium to be absorbed. It is made by exposing the skin to sunlight. That ends the skeletal system.
Potato.